So the problem that I'm working on with BCRF support and in collaboration with a talented group of laboratory folks at Cornell across the street from Memorial is the problem of inflammation and cancer. So that's the introduction, and let me explain why this is potentially important and how this is playing out. So we know that although we can identify the genetic cause of some breast and other cancers, the vast majority of the people who we see with cancer do not have a known cause. They walk in, they say, I've eaten a healthy diet, I've exercised, I've done everything right, and yet here I am, why? And so the majority of the time, we can't answer that question. A second issue is that we see, related to this, around the world, that the rates of certain cancers, especially breast, prostate, and colon, are very directly linked to the amount of calories that people consume per year, and they are indirectly related to obesity. So we've tried to tie together the increased general incidence of cancer in these large populations with the fact that for the individual patients we see, we often can't figure out a reason. The third component of this is the observation that an anti-inflammatory drug like aspirin has been shown in many small studies to lower the risks of certain cancers, especially colon cancer and in some examples breast cancer. So the work we've focused on is the inflammatory pathway, and what we've been identifying is the way in which excessive calorie consumption is associated with a low-level chronic inflammation, and the way in which anti-inflammatory drugs may be able to stop this. And it isn't just to observe this in the patients that we see, but it's also to understand it at the molecular level. And so what we've been able to do in the last few years is to piece together the pathways within the cells that turn on and off specific genes. And one of the remarkable observations that we've made is that inflammation affects the activity of BRCA1, the very gene that we know is inherited in an abnormal fashion in families that have the risk for breast cancer. It turns out that what we eat and perhaps in some ways how we live may influence the activity of that gene when it's normal. And that may in turn affect the course of cancer. So what we're trying to do is to understand this better, to understand the role that this plays in terms of developing cancer and the spread of cancer, and of course to develop drugs that can stop this. So in the past year, Larry asked us what we're most excited about. We've finished the largest prospective and randomized research study ever testing an anti-inflammatory drug in patients who still have breast cancer in their breast, allowing us to look at the tumors before and after treatment to look specifically at the effects of the anti-inflammatory drug on their tumors, specifically the genes of interest. And this is opening up the door to develop better targeted therapies and hopefully not just to treat, but reduce the incidence of breast cancer. Thank you.